Every generation has its call. The greatest generation was called to win World War II.
Beautiful, just beautiful.
The generation that followed won the race to the moon and the Cold War.
Mr. Gorbachev, tear down this wall.
So as COVID appears to be creating the kind of global pandemic we haven't seen in a century, is this kind of our generation's moment?
I would say so. You know, each moment is different. And this one to me is, it's our generation's moment, but what makes it unique is it's based on age group.
The younger adults stepping up to care for, in most cases, the elderly. But with a foe like COVID, it doesn't work unless everyone works together. Tell me a little bit about your team.
When we started getting these COVID patients, when they started building up in our hospital, they didn't stop and say, "Oh no, you know, what about me?" or "Am I going to get this disease?" I mean, there were questions, but at the end of the day, we're a service organization, and it's one of the things I like so much about Wake and why I'm here is like people care. And I've seen staff get COVID. They've been out for a week or two and they come right back. You know, I've got to help these patients. And that, you know, you can imagine that makes me want to go to work. That makes me want to help people.
With coronavirus patients, that often starts in the emergency department. You don't get the mild cases. You get the people who need immediate attention, right?
That's correct. Baptist is unique. We're a trauma center.
So they deal with the worst medical cases on top of COVID.
We're a smorgasbord of everything.
Have you ever dealt with something quite like this?
This is unique. Never had this before. I hear stories about how the HIV/AIDS epidemic happened, how it's similar with the unknowns and how it's progressing.
Which is why they have to stick together like soldiers in battle.
It's a great team. We all come from different walks of life. We work in a high-stress, high-volume environment, and I love working with them.
This is a very close group of professionals.
In the MICU, we're like a family.
For intensive care nurse Jay Perales Avila, that sense of family imbues how they treat each patient.
You never know. That could be your mom. That could be your dad.
They have impressed me beyond measure.
Venice Williams is a nurse manager at Baptist.
How they have to enter the doors and kind of put everything to the side, their fears, you know, the fears of the unknown, the fears of potentially getting the virus themselves. They put all of that to the side to care for the people that need us.
And then seeing the patients in the hospital that are alone and don't know where their families are and, you know, are so sick. I mean, the sickest people I've ever seen. And they're alone. We're all they have.
And sometimes that is enough.
We've heard it a lot. Kind of sounds cliche, but I would just like to say that healthcare workers in here on the front lines, when you actually see what they do and the sacrifices they're making, the sweat, they really are heroes.